Hi everyone, good evening. My name's Erin Worden. I'm an MPA candidate at Wagner School of Public Service. I'm really excited to be sharing space with you all tonight, and I'm even more excited to be talking about reproductive justice. I've been working in the sexual and reproductive health space for the last 4 or 5 years in the humanitarian sector. When I started my graduate studies, I was really eager to work on abortion-specific programs. I was also really hungry to support a humanitarian organization that was on the leading edge of the sector in terms of actively working toward decolonization, really in the weeds and trying to figure out what anti-racist humanitarian programming looks like. That's where Ipas, the organization I partnered with this summer, comes into play. Ipas is a global reproductive rights organization that focuses specifically on abortion and contraception. Working with the humanitarian team, I supported a multi-year research project that was focused on this big question. We wanted to understand pregnant refugees' experiences with abortion in humanitarian settings, particularly if they performed the abortion themselves. This is known as self-managed abortion, or SMA for short. And that's when pregnant folks use a range of abortifacients, from medication abortion to traditional herbs, to end their pregnancies outside of a clinic or medical supervision. This study, which was the first of its kind to our knowledge in the humanitarian space, was piloted in 2 refugee communities, Bidi Bidi, Uganda on the left and Kakuma, Kenya on the right, the latter of which I focused on and supported from Nairobi. Established in 1992, Kakuma is one of the oldest and largest refugee camps in the world. It currently houses about 160,000 refugees, including many of reproductive age. My responsibilities for Ipas were twofold. First, I synthesized data that was collected by some really wonderful community-level partners. I summarized the data into the top 10 findings, 3 of which I'll share with you tonight, noting that the official findings from Ipas are forthcoming. The first finding revealed that over 90% of pregnant women and girls in both settings reported successful and complete abortions. This includes abortions they performed themselves. The overwhelming finding here is that abortion attempts, including SMA, were highly effective. This is put into focus by the second finding. Over half of the women and girls in our study reported potential warning signs of complication. So, in addition to being highly effective, this finding tells us that SMA is also highly risky too. The third finding centers the self in self-managed abortion. Most participants said that they were the primary decision maker in choosing their method or methods of abortion, and that they performed the abortion themselves. This indicates that SMA is highly effective, highly risky, and arguably above all else, highly reflective of women and girls' agency. This brings us to the second component of my summer with Ipas. I worked alongside a really wonderful cadre of community partners to figure out how to translate these findings into something actionable and meaningful and helpful for folks in Kakuma who need abortions. Jointly, we ended up creating a woman-centered design workshop. The goal of the workshop was to invite abortion seekers to create an information-sharing pathway by tapping into an existing abortion hotline that is run in Kenya. This hotline would connect abortion seekers in Kakuma to important information and as well as referrals about how to safely navigate their termination. This corrected for information asymmetries and allowed pregnant folks in particular to understand that medication abortion, which is highly effective and legal, even if tricky to obtain in Kenya, can reduce the life-saving risks that we saw with some of the SMA attempts. Increasing access to medication abortion through awareness and referral pathways may prevent refugee women trying to control their own fertility, an essential human right, from dying in the process. I found Ipas's harm reduction approach to self-managed abortion a really welcome antidote to what we normally see as a dichotomy between safe abortion and unsafe abortion. That binary has really prevailed in the humanitarian abortion programming space up until recently. Our work really centered that above all else, women and girls are the agents in their sexual and reproductive lives, regardless of their circumstances. The role of ethical humanitarian programming, then, is to increase awareness of and access to safer abortion methods for pregnant folks in Kakuma and in humanitarian settings far beyond. I'd like, just as a last slide, to thank the really wonderful folks I was able to work with at Ipas and Ipas this summer, as well as at NYU. Special shout out to Vasuki and Mehmet for their wonderful contributions to the program, John Gershman from the Wagner School of Public Service, and the wonderful group of fellows. So thank you all so much for your attention and for your time and commitments to being, commitments to human rights, which, as Pooja and Yasmin said, really requires bravery. Thanks all.